How are we supposed to keep our kids alive when we don't even have the drug to give them?
New tonight, a local family is worried a drug shortage could cause their 5-year-old battling leukemia to relapse.
According to the U.S. Food and Drug Administration, there's a shortage of a chemotherapy drug known as vincristine.
Physicians say it's a critical medication used to treat most childhood cancers. Here's 7 News reporter Stephanie Bornman with that story.
The FDA says a delay in production caused the shortage, and it could be weeks before a new shipment is distributed. A local doctor says the shortage is inexcusable. He says a lapse in treatment could harm patients. Jack Williams and his little brother were getting into the Halloween spirit, painting pumpkins in the kitchen. 5-year-old Jack has been battling acute lymphoblastic leukemia since he was 2 years old. His mother, Mimi Williams, says the day he was diagnosed, she didn't know if he would make it through the night.
He was given, I think, 14 units of blood and 11 units of platelets just to survive.
But Jack's nearing the end of a 40-month treatment plan.
We are about 10 months out from hopefully finishing this and not relapsing.
On Wednesday, she read this newsletter from the Children's Oncology Group. In it, the chairman addressed the vincristine shortage plaguing the country. Williams says it's one of the main drugs used in Jack's treatment.
How are we supposed to keep our kids alive when we don't even have the drug to give them?
That is what helps keep some of these children, young men and women, in remission. That is part of their cure.
Dr. Robert Siegel, the program director of Bon Secours St. Francis Cancer Center, says vincristine is commonly used as part of a multi-drug cancer treatment.
Vincristine is also critically important in getting people into remission, not just maintaining that remission.
He says even one missed dose could be dangerous.
I am concerned that we're going to see relapses happen where we hadn't seen them before.
Williams says Jack's doctors couldn't say if her son will get his next treatment, and that's not what any parent wants to hear.
And all I can think is that he's going to relapse, that it's going to come back, because we can't give him what he needs. We did reach out to Prisma Health Children's Hospital. That's where Jack gets his treatment. A spokesperson for the hospital says they have no comment about the shortage at this time. Gordon?
All right, Stephanie, thank you. In this country, Pfizer is the only company that makes the drug. We've reached out to them, but haven't heard back yet.